Hello, this is Dr. Sheila, better known as the Pelvic Coach, and today's topic is going to be bladder leaks and aging. Why do I leak more when I get older? Which is a very, very common question, and actually it is a very, very common occurrence. It actually is. That does not mean that it is normal, and it does not mean that it's supposed to happen or that it should happen and you have to accept it. It just means that as you age, it happens. Because as you age, a lot of things happen. And those of us who are older know this to be true. It just is. But anyway, let's talk about I think it's about five. There's about five main reasons why we leak more as we age. Let's talk first about muscle strength and muscle weakness. All of these are, as I'm talking, you're going to see that they're a little related, but aging and muscle strength actually correlate. So as you age, your muscles naturally, for most people, not all, diminish in strength. You have a peak age where you have your peak strength and vitality, and then unfortunately it does get less as you age. Doesn't mean that it's terrible or anything. It's just a fact. So muscle weakness is one of the reasons. The other one is your laxity of your ligaments. So your ligaments, your ligaments hold muscles to bone, and they keep structures where they're supposed to be. So aging makes them just a little bit less tense, strong. And what that does is it kind of shifts where your structures are in your body. And I just want to say this. The shift does not have to be great, right? Because it's a small area in there. So it's not like it's shifting 10, 15 inches. No. The shift can be very small, but that doesn't mean it doesn't change the way your bladder, your rectum, your uterus, where they sit or how they function. So that brings me to the next one, which is prolapse. So pelvic organ prolapse, and there are anything in that area can shift, and prolapse usually means they shift. The uterus can shift down into the cervix and vagina. The rectum shifts into the vagina, so it falls forward, and then the bladder falls into from the front. Okay, so that's kind of where the structures go. Bladder falls into the front, uterus falls down, and then the rectum falls from the back, comes in from the back, right, anatomically. So that being said, those structures can shift and prolapse. That's more common. That's actually pretty common. I won't say it's a huge number, but if you speak to most women, they might know someone. So we don't like to talk about it now. Just say that we don't talk about it a lot, but they do know someone who has either had the surgery or who complains of prolapse, etc. So it is common. That reason, shifting once again. So remember I talked about how everything's related. So the ligaments are not as tight, the muscles are not as strong, and now we have the organs that are shifting either front, back, or down, okay, which changes how your bladder and your urethra can work, because your urethra can prolapse also, but it's not quite as common. Strength, ligaments, prolapse, pregnancies. So if you've had if you've had children, right? I don't know why that took so long to come out, but if you've had children, as they come out, and especially vaginal births, even if it's not a vaginal birth, though, just know, as the child grows, there's pressure, there's shifting. Everything can't fit in the same spot with, with your baby growing. So everything does shift. So the shifting, the changing, the vaginal births where there is a lot of stretching of the area in order for the baby to come out. It does heal afterwards, but if you have had a few children, that might contribute to some ligament laxity and organ prolapse. Could be very slight, but still, as we said, that changes the dynamics of how everything works. So that, and then one of the last ones that we're going to talk about is hormones. So your hormones are kind of what drives some of these other things. So they drive some of the muscle weakness, because estrogen does help you to retain your strength, okay, in general. It also helps to keep the integrity of your ligaments, etc. And your estrogen naturally, it does naturally decrease with age. It just does. So how can we counteract this though? So you counteract it by making sure that you stay active, right? So that your muscles are able to stay strong, or as strong as they can. So they stay strong, especially doing strength training, if possible, is great for any woman. So keep your muscles strong. Make sure that if you have any complaints, any pain, pressure, beginnings of bladder leaks, that you seek help. That is especially important and will go a long way in helping you to not have regular bladder leaks and not have your life disrupted from this. So again, we are out of time, but I do like to keep my talk short just because I know that we are all busy, but you need a little bit of information each time. And of course, it'll continue to build. And some of it's pertinent to you, some of it is not. If you have any true concerns, remember you are going to go and talk to your physician, because this is not medical advice or a substitute for medical advice, but this is giving you the knowledge that you need in order to make sure that you can reduce and eliminate your bladder leaks. So until next time, I am Dr. Shelia, the Pelvic Coach. You all take care. Bye-bye.